I remember when she was a little, baby, and she used to come to my mother's house, and they used to sit on the couch in my mother's living room. And then I knew that she was going to be a great and mighty person for the Lord. And the one thing I will say about her, if I don't say anything else, I know that she loves the Lord, and she's very humble. She has accomplished a lot of things, but you wouldn't know it because she's been around the world as far as putting on seminars and stuff. So but she's very humble about this. So but I'm not no. But the most thing that I'm saying is that, like I said, she's a child of the King, and she loves God, and she want to do any more introduction, she can do it. I told you on college, I know you do research, but if you want to tell them any more, you can. Okay, so at this time, I'm gonna just call Dr. Angelique.
Thanks, Uncle Daryl. Sorry, I got here a little bit later than planned. I was at Kansas Avenue Church for a presentation. We got out a little bit late, but I'm so grateful to be here to speak with you. Thank you, Uncle Daryl. He's a very special person for me and my family. So thank you for that introduction. I'm a breast medical oncologist. So that means that after someone's diagnosed with a breast cancer diagnosis, then they come to see me. There's different members of the team. There's the radiation doctor who does radiation. There's the surgeon who does the surgery. I handle all of the medications. And I practice in San Diego. So as my uncle said, I always look at this. Anything that I do, and also for what I do in medicine, is always I look at it as part of my ministry. I trained right here at Loma Linda for medical school and for graduate school. So that's always my focus. Has always have been on the whole person care. And Oakwood University. Oakwood University, that's right. So I'm just gonna talk for a few minutes. Since this is Breast Cancer Awareness Month. I had slides, but I'm not gonna go through with the slides. I'm just gonna talk to you about some important points that I think that we should always talk about during Breast Cancer Awareness. So during Breast Cancer Awareness Month, a lot of statistics usually come up, such as every 1 in 8 women will be at some point diagnosed with breast cancer. That means out of 8 women in the room, at least one of them is expected to have a breast cancer diagnosis. And with breast cancer diagnosis, it's always important to know that the earlier that it is found, then the higher the chances of being cured. So in the very, very early stages of cancer, we are in the cure rates of over 90%. And for some of them, really, really early, stage 1, we're talking about more than 95%. If it's the earliest, which we call stage 0, 100%. So the thing I want you to take away from what I'm talking about today is that early detection is really, really important. And so there's 2 ways that we detect breast cancer. One of them is with mammograms. So that's getting your annual screening mammogram. And the other way is detecting it with exams, getting clinical exams. We also teach that you should have an awareness of what is normal for you. If you feel something that's abnormal, then you want to get that checked out. So that could be swelling in the breast, that can be skin changes in the breast, that could be swelling under the arm, swelling above this bone here, the clavicle. Any of those sort of symptoms, you want to get that checked out right away, because those can all be symptoms. The mammogram has been shown to find it at much smaller sizes. So even before you're able to feel it on exam, we can find it on a mammogram, as small as a size of a pea. So it's important to do that. Starting at age 40 is what we recommend. That's for average risk. If you have a family history, if you have one or more people in your family that have breast cancer or ovarian cancer, or if you have one or more people or multiple family members, then you may have a genetic risk. If you know that you have a genetic risk, you also want to think about screening before the age of 40. So it's when we talk about screening mammograms, the 3D mammogram is the one that we recommend because it gives a much more clear picture of the breast. You're able to really see what's going on. So when you go and get a mammogram, you want to make sure that it's the 3D or the digital tomosynthesis mammogram. Also, when you get your mammogram reports, it's important to look at whether or not it says if you have dense breasts. If they're very dense, then you want to talk to your doctor about, do I need more than just a mammogram? Do I need an ultrasound? Do I need an MRI? Those sort of things are important to note. So you want to know your density. You want to make sure you get your annual screening mammogram, and you also want to know your history. So those are the things that the main points that I wanted to share with you today as we talk about breast cancer awareness, and keeping in mind that even though we mainly talk about this in October, we need to make sure this is something that we talk about with our family and friends throughout the entire year. Oh, yes. Yes, yes, yes.
Yeah, I know there's some men that can do it. I mean, yeah.
Yep. Yes, yes. Thank you. So there's also men. So about 2,400 men a year can also be diagnosed with breast cancer. Yes. So if you feel anything, so for men, it's also important. If you feel any lumps in the breast or changes in size, one side is a little bit larger than the other, or any drainage from the nipple, you also want to get checked out because men can also, particularly it's more common in men who have a family history. So have multiple women in your family that have breast cancer. You can also be at risk for breast cancer, but it's only 5 to 10% of the time related to family history or genetics. So don't count on the fact that, oh, I don't have a family history. It's more common not to. So if you still have the symptoms or you still feel something, you want to get checked out. Yes, because men can have it too.
Okay, can we open it for some Q and A, some question and
Yeah, I
answer,
can
if you
take
don't
a few
mind?
questions.
I think I saw John. I saw. Oh, you can take it.
I was wondering if you can talk a little bit about diet, and in the Adventist community, we believe in diet, prevention, whole foods, and all that good stuff. But also, another gender cancer is prostate cancer, which is affected. I don't know how Adventists, are looked at, but if you can have any comments on those items.
Yeah. Prostate cancer is also, yeah, exactly, a gendered cancer with males. Again, when we talk about screening, we talked about mammograms for women at age 40. For men, we say screening for prostate cancer starting at age 55. But sometimes if you have a family history, or you're having, or you have someone in your family that had it at a younger age, sometimes you want to start screening at age 40. Or even if you just are concerned enough that you want to start screening sooner than age 55, you have to discuss that with your provider, because it's a blood test. And sometimes in younger men, the blood test is a PSA. Sometimes in younger men, a PSA can be elevated for other reasons. So not always. So we usually start checking later. But if you have symptoms, so for prostate cancer as well, if they start having symptoms, you'll check. But that's something to sort of talk about with your provider. The connection between prostate cancer and breast cancer is one that usually 80% of the time it's one that's fed by our female hormones, estrogen. Prostate cancer is fed by the male hormone, testosterone. So one connection between the two sort of hormonally regulated cancers is there's been a lot of interest in diet and how lifestyle it impacts those hormonal balances. And so a couple things about diet studies, which is a little bit tricky, is the fact that usually diet studies in and of themselves are not very conclusive. Some things we can definitely conclude. We can conclude, and this is most providers are going to across the board agree with the fact that we should have a good diet. We should have, fruits, vegetables as much as we can, adhering to a healthy diet, minimizing as much as we can sweets and those sort of things. That's just for overall health. That's for overall health and overall weight management. The impact of that with cancer is a little bit more complex, because we know that it's not just one factor. We have the genetic factor, 5 to 10% of the time, but we also have environment. We still have the environmental factors. I just came from a conference in Oakland where we were talking about that, the studies that we're looking at, the environment. If you can imagine, we just walking into any room, you're exposed to, what's the materials that are in the ceiling that they use, what's in the walls, what materials and the filling in the chairs when you sit down, so we are constant when we walk outside. So we're constantly getting exposed to different things in our environment. So we can't eliminate all the exposures, but in general, it's always a good idea. I mean, it's always good to try to have as healthy and a balanced diet as possible. Overall, you're going to feel well, but there's a lot of different components that are involved.
I don't know if I can make myself clear about this question. Is about when people they're gonna get treatment or gonna get how do you call example of the cancer, right?
Mm-hmm.
That's true or not. If the person has cancer, but you're gonna get example out of the cell cancer, because when you're gonna get example of that, you're gonna injure the cell cancer, right? So they were saying that it's true that the cancer it will spread faster when you injure the cancer cell.
So I hear that question quite often. So the question was, so the question, if I'm going to repeat it, and you let me know if this is what you're at. So the question is, does getting a biopsy, going in, taking a piece of the cancer, then cause it to spread? Because that's a question that a lot of people ask. And I'm going to add to that. Some people also ask that if I get a mammogram, because you have the compression of the breast in there, in the machine, doesn't that compression sort of injure the area and then also cause it to grow and spread? And so those are two thoughts that I've heard a lot of. And I can tell you, so this question has been looked at a lot, and it's been looked at least as far back as 30, 40 years, asking that question, looking to see. And we found that, thankfully, no, that does not happen. So biopsying the cancer does not cause it to spread or to grow. You will have, naturally, anytime you have some sort of biopsy or any type of, needle or any type of, in the area where that happened, you will have a local sort of irritation and redness for a couple days, and then that goes away. But beyond that short local redness and irritation and swelling, when we've looked at it over time for the last 30 plus years, it doesn't make that cancer then like spread or grow or anything like that. It's still the same as before. Yeah. Yeah. Well, so I think yeah, so I think what happens, we do have, so there are stories that people will give and say, well, my friend or this person, they got a biopsy, and then the next thing I know, like they had cancer everywhere. We've gone back to look at these particular cases, and what it appears that happened, which not knowing exactly, sometimes we don't know the full story. I've had a patient come and tell me this is what happened to her mother. But the actual story was her mother's cancer was already spread before we got the biopsy. She just did not know, and she had not let the family know. But she had been having symptoms all along. So sometimes the stories that we sort of hear are kind of in bits and pieces, or the whole information is not there. So that's why in the medical community, we look at these questions, because we don't want to say, scientifically, we say, oh, well, that shouldn't happen scientifically just based off of the knowledge we know. But we also go and ask the question. We look and we say, if we biopsy these thousands of people, what happens to them? And we've done those studies, and it doesn't spread. Because if we want to know if we're causing it to get worse, we want to know, because we wouldn't want to do that. Yeah. Yes. Yes.
I had a mammogram one time, and they said that I needed to have a biopsy. And so I had the biopsy, and the biopsy said that it was negative, that it was thick breast tissue or something like that. So that was all that happened there. And another thing is, I worked at the Adventist Health Study,
Oh, yeah.
the original Adventist Health Study, and I found that they did not have questions about veganism at all, hardly.
Yeah. I'm sorry. You said that, like, what, they didn't have questions about what?
Veganism,
Oh, they didn't ask questions about that?
yeah. So how could they find out of those Adventists that, are vegans, what their input in was it?
Yeah. Well, I'm not intimately involved with the Adventist Health Study. I do know someone who is, and my understanding is that the information is there. Like, we have so much data, information that we've collected from all the people that participated. It's just having the researchers with the right amount of funding, because all of these studies take money to come in and ask those questions. So my understanding that they do have that data about the diet, if they're vegan, and they could ask. We can ask these questions, but we just have to get the interest and the funding to do it. So I guess the point is, that study I think that study will be done, and we can get that information.
It's quite an extensive study.
Yeah, it's an extensive study.
Very
yeah,
extensive.
which is good. It's great that we have this database.
Yeah.
Because we're also getting, internationally, a lot of attention about being the blue zone and all of that sort of thing. So I think those, and we do have such an extensive, and it's over such a long period of time, that you don't really have a lot of studies or that have that. So I think that is going to be done. It just hasn't quite been done yet. Yeah. But thank you for participating in that study. Oh, nice. Wonderful. Nice. And we should, if we have the opportunity to participate in those sort of things, to contribute to the body of knowledge. And the thing that you said about the biopsy, yes, that does sometimes happen. So if we see on the mammogram something that looks abnormal and you get a biopsy, the good news is that the majority of the time they come back and it isn't cancer. So just make sure that, just having them call you back for a mammogram is not always meaning that that's going to be a cancer. It could come back and be benign.
Over the years, we've been encouraging our moms to breastfeed
Mm-hmm.
their babies. That's supposed to be a protective factor
Mm-hmm.
against breast cancer and cervical cancer, if I'm not mistaken. Do you have any data on that?
Yeah. Yes. So you're right about encouraging to breastfeed, because we have found initially the thought was that we were seeing fewer people with breast cancer who breastfed, and then somebody did do the study, and it showed. So there's several studies now that show just that breastfeeding does, and we don't know. Well, so breastfeeding and breast milk. There's so much protective benefits. We don't know all the things that are involved. But one of them is it does cause an actual change in the breast tissue itself that is protective even over the whole lifetime of the mother. So, yeah, so definitely breastfeeding is helpful. Mm. Yeah.
Have they improved the mammogram machines? Because I haven't done that for decades. It just smashes my breast and it hurts, and I think it's injured actually. So
Well, thank you for sharing that. Sorry to hear that was the experience, but that was the experience that you just said was experience of many women, and that was kind of after they had get their mammogram, and it was so uncomfortable they didn't want to go back for more mammograms. But the answer to your question is, thankfully, I can say yes, they've improved them dramatically. Is there room still for improvement? Hopefully, medicine, we're always pushing the field to improve, but it's much better than it was definitely 10 years ago, but even 5 years ago, because the new mammograms that we have, the paddles are different. So it used to be this, it was very, very hard compared. Now, because with the 3D mammograms, they're so good at getting the pictures, it's faster, and they don't have to do compression as much. Like they used to have to really do a hard compression. Now it's just more like it's not such a hard compression. It's more just like a mild discomfort, but it's like as soon as then it's over. So the paddles are larger for that reason. They can get the images quicker, so you're not in the machine that long. And you don't have to keep repeating a bunch of pictures like before, too. They're like, oh, we have to keep repeating it. So it's much better.
I might do it again.
Yeah, yes.
Quick question. I'm just curious that women who wait to have children, later in life, I'm not one of them, but those who do, is there a higher risk of having breast cancer?
Yeah, so they have found an increased risk with if you are waiting longer. And so the thought there is because breast cancer is associated with your exposure to estrogen. And so there's a different change. So when you are pregnant and you're pregnant at a younger age, it's really about the length of time that you're exposed to higher levels of estrogen. So the more frequent, if you've had more pregnancies, then you have this lowering of the estrogen. So you have periods of time where you didn't have a lot of estrogen exposure, but also if you were younger. So, a lot of times older women who have never had kids, you've just had this sort of high level estrogen, like uninterrupted. So that's the thought there. It's not a dramatic, as far as, it's like 2 or 3-fold. It's just one of the pieces of things that we kind of look at with but so it's not that that it's so large that we would tell women, just go out and get pregnant. But it is one of the pieces.
If there's no more questions or comments, I mean, well, we want to thank,
you.
Dr., you know. Father God, once again, we come before your presence. We'll thank you for what our eyes have seen, our ears have heard, and our hearts have felt today. Be with us now, Lord, as we're still in the Sabbath hours. Help to continue to keep your Sabbath holy, and help us as we go our separate ways, that your guardian angel will guide and protect over us. Once again, we ask you to be with Pastor Hurl and be with Elder Duke Duke in a very special way, and be with other members of the church. We pray this prayer in the name of Jesus. We do pray. Amen. Well, I guess you consider yourselves dismissed.